Good evening, everybody. Welcome. Thanks very much for attending this evening session of talking about socialism from a Marxist point of view. Tonight's discussion is going to be on the crisis in health and social care. And we've got Ian Spencer with us, who is a trained nurse and is currently lecturing in health and social care at a further education college in the Northeast. He's going to introduce the discussion for about 15 minutes in a short while. Same rules apply today as always. This video is recorded. It's going to be posted to YouTube probably tomorrow morning. So if you don't want to be seen, turn your video off. If you don't want to be heard, make sure you don't say anything that you shouldn't. And if you're watching this on YouTube, as quite a lot of people have started to watch these videos, please do press the subscribe button so that you can get informed about any other videos that we post. We're going to do something slightly differently today. We're going to finish the discussion a bit earlier so that we can give a brief report on the various discussions and meetings that have taken place in the Forging Communist Unity process. That's the discussions between talking about socialism, the Communist Party of Great Britain, and the Prometheus online journal about the possibility and looking to the possibility of a fusion of those organizations, which we're quite enthused and excited by. So we'll come to that at about 8:45, and anybody that's got any questions, we can deal with those at that moment. If you don't know, my name is Nick Rack. I'm one of the organizers of Talking About Socialism. Once Ian's introduced, we'll open it up, and we normally give 3 minutes, but if there are any serious differences or questions, we'll give a bit more time. And that's done in order that we can get everybody into the debate that wants. It's a topic upon which I'm sure everybody has something to say. And therefore, I'm going to now ask Ian, who I should also have said is a member of the Communist Party of Great Britain. We're pleased to have him today. So Ian, off you go. Thanks.
Right. Good evening, comrades. I'm just going to share my screen because those of you who wake up in a cold sweat every time you think about PowerPoint, don't be alarmed. It's just short slides, really, just as an aid memoir for me, as much as anything else. Can you all see that all right? Can you see that all right? Hello. What's that? Yeah. So is that okay? You can see that, can you?
That's better. Yeah.
Yeah.
That's much better.
Yeah. Okay. There's a couple of things I want to say. One is obviously, there is a crisis in health and social care in the sense that there is a real concern about the affordability for the future of a fully state-funded system. Now, I want to just suggest a few little things. First of all, the welfare state, of course, isn't socialism. The NHS is not a little island of socialism in a hostile sea of capitalism. The most important thing from my point of view is that healthcare is absolutely free, and moreover, the distribution is according to need. And there, the relationship of the NHS to socialism is really comes to an end. But having said all that, I would defend it with my life. And I think the important thing here is twofold. One is to talk about the origins of the so-called crisis in social care, health and social care. And secondly, to talk about the way in which it's a good illustration about the way in which capitalism in decline throws up these contradictions, not least of which because we see there is a glaring need for free health and social care. and that's a glaring human need across the board, and one which stands in contradiction to the capitalist desire to extract the last drops of surplus value out of the working population. Um, so I'm going to suggest that what's at stake really is that the very idea of capitalism as an impediment to the further development of humanity. That in fact, the tend and people aren't living longer, more people are living to be old, and that is one of, in a sense, a great achievement of capitalism. That we have a kind of a nutritional status and the potential for abundance that capitalism throws up, and without that, the pre-industrial average life expectancy was below 50. Although that's a little bit misleading because average life expectancy is heavily influenced by the number of children who die. So before the Industrial Revolution, if you lived to be 5, you would probably live to be 55. But of course, high infant mortality rates mean that the average life expectancy is quite low. But the other thing I want to draw attention to is the capacity for the workforce in health and social care to be central to the demand for socialism. And here I use the term socialism and communism interchangeably, as I'm sure you do yourselves. As you know, last year was a period of unprecedented political activity among doctors and nurses and a whole range of other healthcare workers. And not that that's anything unusual. The first strike by what we would now regard as nurses was organised by the Asylum Workers Union in 1910 as a response to the Liberal government of the day. And so there is a long history of industrial action within healthcare. What's important here is that we hadn't previously seen, for example, medical practitioners going on strike. We hadn't previously seen the Royal College of Nursing going on strike. The Royal College of Nursing has had an invidious history in terms of selling out whole loads of other health workers back in the 1982 health workers dispute, which I'll come on to. And I think to understand that process of proletarianization in all ranks of the health service is an important feature of the crisis in health and social care. So just to wind back the clock a little bit, this is Netherton Hospital, Coulsdon in Surrey. It's now a kind of swish housing estate. It's the hospital I trained in. It's a big old asylum built in 1905. The other great speech of Enoch Powell's that people tend to forget about is his Water Tower speech, published in which was in 1961, which ironically was published at the same time as Irving Goffman's epic book Asylums. It's a mistake to think that the Mental Health Act of 1959, which created the category of informal patient, was the reason for the closure of the asylums. There was already a significant change in people's attitudes towards mental ill health and meant that more people could be discharged. Why I mention it in this context is, of course, it also coincided with Enoch Powell, who was Conservative Health Minister of the day, who in 1961 effectively announced the decision of the government to close down the asylums. And so the process by which we see a crisis in health and social care was really begun here in earnest. Netherton Hospital had over 1,000 beds when I was there as a student nurse in 1979. And 95%, if not more, were informal. That is to say, they were not detained compulsorily. Nowadays, compulsory detention in psychiatric hospital is the norm rather than the exception. And also, 2/3 of those patients in those days were old people with typically organic mental disorders, the dementias of one sort or another. And now we have a situation where the dementias of one sort or another are alone among neurodegenerative disorders as of not being paid for by the National Health Service. Increasingly, as we see people are compelled to pay for it themselves if their estate is above a certain threshold. And increasingly, too, even if they do receive funding, it's usually from local authority, and increasingly, of course, in a privatized system. Most of the care homes that look after people with the dementias are one way or another um, private. Um, I wanted to mention the 1982 health workers dispute because it was the beginnings of a rapid acceleration of the decline of the asylums, because the defeat of the 1982 health workers dispute was not only a defeat of the last strike, where there was widespread solidarity action. I mean, train drivers and postmen and all sorts of others came out on strike. And there was more other workers out on the picket line with me in Redhill General Hospital in 1982 than there certainly were nurses who didn't join in the strike at all, at least those not in the Royal College of Nursing. The other thing about the closure of the asylums that's often overlooked is that it was the closure of what was the NHS union base, really. The overwhelming majority of the workers who worked in the asylums were members of either the National Union of Public Employees or the National Union or the Confederation of Health Service Employees. COSI, in fact, was an amalgamation of the Asylum Workers Union and the Poor Law Officers Association. So the closing the psychiatric hospitals was also the closure of a large part of the trade union base of the NHS. And instead, the two-thirds of the patients who were in the old asylums typically then ended up in private care homes, and effectively care being valorized in the interests of capital. There were, of course, so-called Part 3 accommodation, which was provided by local authorities back even then, but that was usually directly funded by local authorities and local authority care homes operating with local authority terms and conditions of service. What you now tend to see, in fact, is that the care homes tend to be on most of the carers are on minimum contracts, and if they do get paid any more, even if they're working nights, it's often a flat rate of pay. But just to put it into perspective, there are 1.4 million people working for the NHS. There are 808,000, nearly 808,500 on the Nursing and Midwifery Council register. That's nurses, midwives, nurse associates, and so on. Many of those are from outside the EU and European Economic Area. And a constant feature, the number of vacancies. Effectively, the NHS can't get enough staff. So 11.8% of the nursing workforce is vacant. 1.54 million people work in adult social care, and 78% of that is in the private sector. So what we're looking at, apart from anything else, is not only the biggest single in the NHS alone is the biggest single employer in Europe. It's the sixth biggest employer in the world after, for example, the US Ministry of Defense, the Chinese People's Liberation Army, and the Indian Ministry of Defense, and one or two others. Oh, yes, Walmart and Amazon are other significant employers. But other than that, the NHS is the biggest single employer. And that doesn't even take into account all the million or so who work in adult social care. The other point about it is the way in which the NHS is funded is often being described by politicians as somehow something unaffordable. What I would point out is that although Britain doesn't necessarily compare very well, for example, here is Britain, if we look at life expectancy as one simple measure, and it's not necessarily a very good one, but it is a measure, we could just as easily look at illegal drug use or a whole range of other things. But here's the UK with this sort of balance between health expenditure per capita and life expectancy. Here's Japan, by far and away the market leader in that sense. And of course, Japan has a private insurance system with a safety net. But what's so striking is the very poor performance of the United States, both in terms of life expectancy and in terms of the sheer cost. The United States spends more on, both in absolute terms and as a percentage of gross domestic product, on healthcare than any other country in the world, and achieves an outcome which is far worse than many developed countries. And in fact, for urban black men in the USA, the conditions are often worse in terms of life expectancy and both morbidity and mortality than many much poorer developing countries. Um, the Department of Health looking at something like 180 billion in terms of its budget, and around half of that goes on staffing. But notwithstanding that, it's a far more efficient service the system than the US system. But notwithstanding that, there's a tendency to head in the direction of a US system, a US style system where there would be, as it were, a safety net in the case of the USA, Medicare, Medicaid, but the majority of it being paid for by private insurance. Some of it, of course, paid for by employers as a kind of as a perk for working for them, not least of which by the US military. One of the few ways you get free healthcare in the USA is if you're in the armed forces, where you draw upon the Veterans Administration. Increasing number of American companies invest in the USA, in the NHS, and effectively are able to brand themselves as NHS facilities, providing they meet certain criteria. I, for once, worked briefly in a small psychiatric hospital just outside Durham, which was a private hospital run by an American company called Cambion. It's now run by another American company called Signet. And so this is what we're seeing is a piecemeal purchase of chunks of healthcare, and an increasing tendency on the part of people frustrated, understandably, with the long waiting lists and all the rest of it in the NHS, who are taking out private healthcare insurance. So over the last 2 years, private healthcare insurance has grown by about 10%. So what we're seeing is US investors greedily eyeing up the opportunities for rich pickings. And of course, Wes Streeting himself has taken money from private um, medical companies, hoping to invest in the British NHS as it's sold off piecemeal. Um, there is a kind of increasing integration of the care home system with the NHS. One of the last jobs I did in the British university sector was working for Newcastle University, where the government-funded research was going into the establishment of a minimum data set for care homes. And the idea of the minimum data set for care homes is that they can then be more fully integrated into the NHS. Not integrated in the sense of being free at the point of delivery, but in the sense of being able to take patients, paying patients, or patients paid for by private insurance or by the sale of the person's house or whatever, but that would become a kind of more fully integrated part of the NHS. So, for example, you go into hospital because you've broken your leg, you get it fixed, and then you go out to a private care home for rehabilitation, and that's part of what the minimum data set research was keen to look at. Is there a way in which they can do it? What happens in Canada and the United States? In the United States in particular, if you're a care home and you want the funding from Medicare, Medicaid, you have to be signed up to the minimum data set. So a common computer system for managing the processing of patients from the public hospital sector into the private care home sector. So those are the figures: around 16,700 care homes in the UK. Most are privately owned. A population in the care homes of nearly 500,000, and about 70% of those are memory impaired one way or the other. And around only around 30% of the beds are designated as nursing. Most of them are designated as residential, although in practice, having worked in both residential and nursing homes, the difference is largely negligible. Around 50% of people in care homes are effectively self-funding. What that means effectively is your house you'll have to sell your house, and if your estate is above £34,000 or thereabouts, you'll pay the full cost. And when it gets down to about 14,500, then and only then will the local authority step in to continue to pay your bills, if indeed they do. Obviously, it will depend very much on what their whatever cap is applied to what they're prepared to pay. You'll not get them paying for Bupa, who do very nice care homes, I can assure you. So and the interesting thing as well is that along with the sort of 1.4 million workers in the NHS, you have a workforce in care homes alone of 750,000. But here's the other thing. There are 131,000, estimates vary, but it is as high as possibly 150,000 vacancies in social care. And when you look at the pay of social care workers, it is absolutely not surprising. So it's a crisis in two important ways. It's a crisis in the sense of that difference between the expectation, the possibility, the human potential of human social care and of meeting human need, and how that comes up against the rapacious needs of capitalism to squeeze more surplus value out of the population. And it's a crisis in the sense that this simply isn't sustainable. And what's interesting about it, of course, is the proportion of the money spent on the private social care sector that, of course, goes straight into the pockets of the shareholders of the private care homes. And but the difficulty of rowing back from that. The NHS was founded at a time when it was felt necessary to make concessions to the working class on the basis of not only the sacrifice of the Second World War, but the realization that the existence of the Soviet Union posed another alternative, even if, in fact, in practice, the Soviet Union did more to impede the workers' movement worldwide than almost any other force. Notwithstanding that, the very fact of the existence of the possibility of another world was enough to make the ruling class make concessions. They now have no such need to make those concessions, and what we're left with, comrades, is naked class struggle. So, thank you.
Thanks very much, Ian. That's great. Almost bang on time, so thanks for that as well. Okay, if you could get rid of that's great. Okay, so comrades, I'm sure everybody's got something to say on the question of health and social care. So I've got Minnie's got her hand up straight away, so I'm going to call in Minnie, but please don't hold back. I've got Minnie, then I'm going to call in Mary Whitby. Thank you very much, Minnie.
Yeah, hi, great to see Mary and Irene on the call. Fantastic local health campaigns for health. Yeah, I just wanted to say Palantir has a data contract for our NHS, and the CEO of Palantir, Alex Karp, recently said there's video of him speaking to retail shareholders, he's really happy about Palantir's success. He loves their success in the US, UK, and many places. He says Palantir is here to disrupt and make the institutions we partner with the very best in the world. And when it's necessary to scare enemies on occasion, and on occasion kill them, and we hope you're in favour of that. We hope you're enjoying being a partner. We're really, really happy, and we're really, really focused on what we're doing. This is the company, Palantir, which has connections with CIA, is it? And it has a data contract for the NHS, openly talking about, if there's any enemies there, we'll kill them, we'll get them out of the way. Enemies. Speaking of enemies, the working class are the enemies of the for-profit health system. It's going more and more that way in this country. 500 people were dying a week due to A&E delays. Uh, you've got United Health. So Simon Stevens, was it? He was head of he was in United Health, quite high up exec. And then he was appointed head of NHS England when it was split into 42 different areas, each with a budget. And when that budget runs out, then there's cuts. And then we've got Wes Streeting in the UK. He's appointed another health privatiser to oversee a 10-year NHS slash and burn plan. A guy who worked for McKinsey, is that like a consulting, accounting kind of company that have done lots of work on cuts in the NHS? And if you look at United Health and the NHS, you've got Luigi Mangione, who well, allegedly, it looks like he killed someone. He's been charged with that anyway. He is being, and United Health are restricting care. They've got algorithms. It's coming here. They've got algorithms for people's insurance denying care. They're now going after doctors who are starting to blow the whistle. One doctor in the United States was called when she had a breast cancer patient on the table operating on her. They called to say, well, we don't think we don't want to give you the funding for that patient to be able to stay overnight in the hospital. And now United Health are going after her. I mean, I could go on and on and on. We've been lied to about COVID. It compromises people's immune systems if you catch it again and again. It weakens people. TB is up 50% rise in tuberculosis in the last 2 years. Then you've got to remember there was the Nottingham murders, where those poor students and the caretaker were murdered, and the very, very brave parents and son of the caretaker were on television the other day, and they actually said, and they had a list of organisations, including the police, social care, and on that list was the NHS. If you live in Nottingham, the NHS isn't coming to help you. Police aren't coming to help you. All our institutions, they're not coming to help you. And that ties in with what Ian was saying about mental health. The guy who committed those murders wasn't taking his medication for schizophrenia. It wasn't being ensured that he was taking his medication. He was out in the community and he didn't have care, not enough care in place, etc., etc. I could go on and on. There's just so much here, but I'll leave it at that for now. And I totally agree with Ian. Capitalism is an impediment to further development of humanity, and our health is above all everything so important.
Thanks very much, Minnie. Great points. I'm going to call in Mary, who I think is at your first meeting of TAS. So welcome. Thank you.
Yeah. Hi, thank you. Thanks for the talk. And Minnie said some of the things I was going to say. But one of the things, and we are NHS campaigners, and we are pointing out that we have already lost the NHS because now it's been replaced by 42 integrated care systems, which are American systems. It's not coming, it's here, it's already been done. And it's not that they're sitting in the sidelines waiting to invest. They are extracting billions out of the NHS and have been doing for years. And they're actually embedded inside it, restructuring it to suit their business models. So here in Lancashire, we've had Optum embedded for years and years and years, and they are the European or UK arm of United Health of America. And already 7.6 million people are being denied care because you can't make money out of ill health if you treat everyone like the NHS used to do. So you can only make profit if you don't treat people, if you take the money and you don't treat them. And these organisations and different parts of the NHS have been incentivized to not treat people. And is it a crisis if it is the entirely foreseeable outcome of 40 years of policies to bring us to this situation? It's not a crisis is unforeseen, it's unexpected, it's not something that you expect to happen. Whereas this is deliberate policy to systematically dismantle the NHS. And when they legalised, because Simon Stevens came, he restructured the NHS from within without any legal or political mandate. And he actually said in a parliamentary committee, we'll do 90% of the restructuring, and then you might have to do the legislation, the last 10%. And that's what they did. On the 1st of July 2022, they passed the Health and Care Act to retrospectively legalise integrated care systems, which were previously called accountable care organisations, which are American models. And the chair of the Lancashire and South Cumbria integrated care system was cock-a-hoop on the 1st of July when they met and said, oh, I should have counted how many times he said it was very permissive, the Act. So they basically can decide what services they offer, what services they won't bother offering, which of us is deserving enough to access them, and which companies get the lucrative contracts. So they're not putting money into the system, they're taking money out. And the fewer people they can treat, and the cheaper they can treat them, the minimal amount of care they give, and they use cheaper staff. So we are seeing doctors being replaced by unqualified people called physician associates, which are also an American model. And they were introduced in 2003. And the unions have colluded along with the Royal Colleges to restructure the NHS, to smooth this transition to this American system. Sorry, we won't keep going on. But in 2006, they signed up to the Social Partnership Forum, which meant that staff and patients were all in the dark. We've all been in the dark about what's happened to the NHS, and still most people don't really understand what's happened to it. And it's really dangerous. 7.6 million people are being denied care. Over 1,000 people die as excess deaths a week. Life expectancy is falling, and there were more deaths than births this year. So, and people might live longer, but they're living longer in ill health. And so what I think we need to do is fight to reinstate the Bevan model and renationalise health, because our lives depend on it. All right, thanks.
Thanks very much, Mary. Really great points. Thanks. I've got Peter and then I've got Will. Everybody else, get your thoughts together or questions, and look forward to your hands going up. Peter.
Hi there. Can you hear me?
Yes.
Yeah. The 13th talk was great, and particularly the point about going back to the mid-20th century, social democracy, Stalinism, the idea that there was a need to take in the strength of the working class, which is aligned to the kind of established development of a undemocratic planning process, which married the market to the undemocratic plan, and that was institutionalized within the NHS. So I think that's important to do that, because the NHS, in other words, was born of a kind of separation, if you like, between use and exchange value. Prior to that, health was thought of more as an exchangeable commodity to be bought and sold. There was a growing trend throughout the late 19th century, 1910s, 1920, to develop various social insurance acts, and it depended on one thing: the strength and force of the working class to push those things through. I don't believe that capitalists are horrible people and that's why they do it. When we talk about the privatisation right now, I believe it's the system will revert to what it can get away with, and it's folded in on two disciplinary constraints. One is the constraint of maximising profit, and the constraint that puts on cost effectiveness, making sure that the resources, i.e. human resources, as we're called, are used to the maximum efficiency to boost profitability. The other discipline is the discipline of the always tight budget. The always, the budget that's always got constraints attached to it. unless you're engaged in quantitative easing within the Bank of England, then there's no no constraint on budget there to finance that. So there's a constructed nature of the budget deficit or the budget controls, and they act as two disciplinary forces: the profit motive and budget constraints. And within that, we get the horrible mix of private and plan. But the rearrangement of the plan over the profit system, the mix of private and public, if you like, is all based on the balance of class forces. If you look back in history, that's the way. As he mentioned, just hard back there, the working class, although controlled within what I would call labourism, which underpinned the social welfare state, they had a certain objective strength, and that was manifest in the breach in the commodity form, which produced a whole set of industries which became nationalised. They weren't democratic, but they were out with the market, out with the commodity structure as such. But they were there as part of the reproduction of labour. So capitalists gained from the reproduction of labour. And I would say that when you look at the way things are shaped across the world, because if you look across the world on NHS, the hospitals and their systems and the variation, then it's a mix of hierarchy, undemocratic hierarchy between state, between regions, and between community, GP practices and community health. Some are more open than others. And then the mix is also in the arrangements of what is privatised and what is produced by the state. And they're informed by the balance of class forces. But ultimately, it comes down to why does capitalism have to, despite itself, have a healthcare system? Well, it's because of its reproductive role for productive workers. To keep productive workers healthy, then we have to have a set of unproductive workers, which we have to cost cut and rationalise as much as possible, give them as much low pay as possible, which is really like most people who work in the NHS and social care are not highly, obviously nurses and doctors, highly professionalised, but most people that work on poor pay, poor conditions. Capital requires this system because it has to furnish a reproduce labour power, which goes into industry and earns capital profits through extraction surplus value. But you'll note that with social care, that's related to not only unproductive labour in the sense of not producing expanding capital, but it's also unproductive as being unemployable or no longer employable. Older people and people with disability who are far from the labour market. And that's a reflection of a deeper understanding, a systemic understanding of unproductive labour. Labour that can be disposed of, labour that it's not too much important for the system not to do much about. And that's reflected in the kind of service that you get in the social care industry. And it was important for the NHS to cut off the social care system from the NHS, from the healthcare, to do that. And that was done in the late 70s, early 80s.
Thanks, Peter. Great point, Sam. Sorry I had to cut you off. And may get time to come back in a second time and finish off those points. I've got Will and then I've got Janet.
Yeah, a series of kind of disconnected points, really, because whatever people have been saying up to now has been really interesting. And it's made me think a few things. I'll be as quick as I can. I just wonder, Ian, how far you think we would need an NHS of this size and scope if we weren't living under capital. Because it strikes me that capitalism is an incredibly harmful system to people in lots and lots of different ways. And you could have an entirely different health approach if capital didn't operate in our society. And I agree with Peter that basically, these aren't wicked people doing wicked things. This is operation of capital accumulation. I mean, they would privatize absolutely everything if they could. It can't, that's just the direction that capital travels in. So if you think about the number of people killed by tobacco, legislated for, legalized, killed a lot of people, cost the NHS loads of money. If you think about, I always remember the Labour in 2001 sending a text to students under 21 saying, vote Labour, vote 24-hour drinking. Yeah. If you think about the way that our food has been adulterated, and Engels wrote a lot about that, but they've taken the adulteration of food to an extremely high level, and there are real concerns about cancers appearing in much younger people and where that might be coming from. So capitalism is a really harmful system, and it just kills people through its operation in everyday life, really. And you just think of the number of people who worked in the past in industries where they've got lung problems, they've got disabilities, they've got all sorts of stuff from being part of the capitalist system. And so I just, we clearly have to remove it as a system because it's kind of a really terrible system. But I just wonder what we think it might be replaced by, because I don't necessarily see. I wasn't a deinstitutionalizer, actually. I wasn't, I wouldn't have favoured deinstitutionalization in the way that the Liberals did. But I'm just wondering what a community-based health service might look like, and one that's under kind of popular control, and how you would see that. And there's just one other thing, which is you were talking about the care homes, and I've been working with Age UK recently, and talking to one of the people that does policy for them, and I was just getting a picture of what's going on inside care homes, and she started to talk to me about the disappearing middle. And I said, what do you mean? And she said, well, actually, there are people who've got enough money to pay for their care homes, and there are people who haven't got any money who get local authority care, poor though it might be. And she said, and there's people in the money that are just in the disappearing middle. And I said, well, what happens to them? And she said, I'm sure in the data, if we look to find it, there'll be lots of people who are elderly who are simply dying at home because they feel trapped and they can't pay for it and they can't get help. So there's this kind of hidden health crisis, I think, that we kind of need to think about. I'll stop there.
Again, excellent points, Will. Thanks. Just triggered in my mind issues of mental health produced by the capitalist system, work, debt, housing, etc. How that would be addressed by a different system. The explosion in diseases like diabetes, the adulteration of food with sugar, and so for young people. So something that other people might want to come in on, and Ian at the end, is the question. You can't look at the question of health and health care without looking at the system overall, it seems to me. I'm going to call in Janet now. And then,
Yeah.
Sorry, Janet, I've got Jeff, and then I've got Irene.
Okay. Yeah, just a few unrelated points, maybe unrelated to some extent. Just one on integrated care systems. I retired 2 years ago, whatever, from doing policy work, including health, but so I may be out of date, but I don't recall any opposition from local government to integrated care systems from at a national level, which I was working at, and at local authority level. And there seems to be this delusion, really, that integrated care systems are a way of promoting a sort of holistic, the holy grail of health and social care working together. But I also don't remember any real opposition from the trade unions. I may be wrong about that, so maybe Ian could elucidate a bit, but I don't remember that. I just wanted to say a little bit about sort of what Will was referring to a bit, what Nick was kind of saying, but actually not quite saying what they're saying about, well, about capitalism, but about the causes of ill health. And I don't think we can really just talk about something like, people smoking more or having, contaminated food. I don't mean contaminated, but unhealthy food, if we're not looking at how that impacts and why it happens. And it's very clear that health inequalities is getting worse, that the causes of ill health are also in many ways getting worse. So that I think somebody mentioned life I can't say the damn word, whatever, has been reversed. I think in some sectors of the population that's true, and that's the first time for many, many, many years. And the reasons for that, I suspect, are not mainly about the system or the healthcare system or social care system, but about the increasing inequalities around poverty and poor housing and so on. And we only have to look at, some London boroughs where life expectancy is at in one end of the borough, and it may be 5 or 10 years for a male difference, huge glaring differences. And also if we look at places in the northeast or probably in Liverpool and so on. So I think we have to look at that in the wider context, and maybe that doesn't answer anything, but I mean, maybe it's a point to answer what Will's saying about a different system. It's clearly not just about the system, it's about the causes of why we're in the state that we're in. Just about social care, it seemed to me, I did a lot of work on COVID and social care, that COVID actually exposed graphically what I think Peter was talking about, the huge differences, really, or the difference between the NHS and social care. It's clearly the Cinderella service in every single way. You look at training of social care people, you look at the way they're paid, particularly domiciliary care workers and so on. And I think Starmer came in saying he was going to do something about all of these things, as well as about how we pay for social care. Clearly is going to do absolutely nothing. So it always annoys me when people are talking about, not anybody here, nobody said this, but talking about, the decline of health, and they never seem to talk about the real crisis. I mean, the mega crisis in social care, both for workers and for us, for people who will grow to depend on it. That's it.
Thanks very much, Janet. These are all brilliant points. Jeff, and then Irene. Jeff.
Right, a few points. What I found, I mean, Ian's talk was very good. What I found in campaigning is that nearly all the campaigns are defensive. We've done really well in battling to keep something open, particular institutions, a local hospital. Certainly in Devon, there have been some very vigorous campaigns. The trouble is that when we say bigger questions, there's far less interest, and it's very difficult to rouse people. But I think we've got to ask, what do we want from a health system? It has to be integrated with fitness. It has to be integrated with education, of course. And of course, the big killer, which there's some evidence of, is the environmental decay and decline. And of course, as a subset of that, work. The dangers at work, which are not what they were in the 19th century, but they're still around and considerable risk. So what we need to think about, I think, is integrating those things in preparing alternative health policies and not being stuck with purely defensive policies. A word about Cuba. Yeah, it does really well, but of course, a large part of it is because it's cut off from the massive problems of Latin America, of massive use of Coca-Cola and things like that. The high sugar content in much of Latin America is killing people off at a pretty rapid rate. So that for Cuba, it's not merely their health system and their doctors, it's also their dietary system. And I think unless we look at all of those things in the whole, we're not really dealing with health. And in preparing socialist policies towards health, we have to think of all of those things. Thanks.
Thanks very much, Jeff. Irene Leonard, thanks.
Okay, I also was going to bring up Cuba slightly differently, though, and it's because of its ideology. As it's not just, yes, the embargo has decimated the country and the people, and it was the biggest sugar producing country before the revolution has happened, which is neither here nor there. But Cuba's philosophy and its funding and its valuing the security that a good health system provides its citizens, and the work that the researchers doing that is a standalone as well. I think the Sandinistas did the same when they took power, and throughout a lot of the private practices. So it's if you're thinking of a different system, it's setting the values first of all. And in terms of our system, I worked in health. When you are earning money at whatever level, you can buy off your dissatisfaction to a degree. And consumerism has damaged the British psyche, I think, very much. Now that the economy is failing, that false protection has been taken away. And there's nothing in its place because the welfare state's being broken down as well. So now we have a population of vulnerable, scared, insecure people. And when the stress for me, the one I worked with was the stress model of in health. If you put anything, table chair, light person, anything, under enough stress, it will break to a degree, and that stress is different. So there's so many issues we can think about, and in our local communities, we can do small actions to assuage some of those problems or attempt to, as well as just the bigger issues about the provision of an A&E and that sort of things. I think we need to do both, look at the lives people are living in our communities and support them and reduce the stresses as much as we can, and look at the environment, as well as the provision of higher level health interventions. I'm sorry, I hope that made sense. But anyway, Cuba does it quite well. And we saw Che Guevara's daughter, Alida Guevara Marsh, who said that people had to watch their weight. And she was not a lightweight herself, but she was very good. And she sings the International brilliantly. Thank you.
Thanks very much, Irene. That's great. I've got Soraya, and we may be able to squeeze in one more after Soraya before I call Ian back. So Soraya.
Just very quickly, it's and other comrades have commented on this already, but capitalism creates the illness in society in so many ways, physical illness and also mental health illness, because of the way it produces food, because of the environment, and then it blames the working class and people who fall ill, both physically and mentally, blames them as if they are a burden on society, when in fact the burden on society is the capitalist system, which destroys everything in its way. And so it then has the, I say, audacity, but it blames people, but it also criminalizes people with mental health problems. So it doesn't want to care for them properly. So you have the people being out on the street. I'm not saying everybody should be locked up. I'm just saying that they should receive help, care, assistance, proper help, care, and assistance. But then people who are not being helped properly then are criminalised when they're out on the street, when they commit crimes. Now, don't get me wrong, I'm not saying people should be allowed to go out and stab people, kill people, whatever, assault them. But it actually spends more time and money on doing that process so that it can say it's these people, it's not society, it's not the capitalist society that creates these problems, that creates the mental health problems. It's the people as individuals, and they are just bad. And for me, that is just an example of how rotten the capitalist system is. And it's as well as privatizing. I mean, they are, as other comrades have said, privatizing, going to finish off the health system. But it seems to me, a long time ago, I lived in Italy, and you had people wanting to become doctors who would work, and this is not an exaggeration because I knew people who worked for years for nothing as doctors, as trainee doctors who didn't have a post in hospitals, and they kept the hospitals running. And you had a system where, in terms of the elderly and those who needed to have care homes and so forth, they were just looked after by families. So essentially, if you had a family in a wider family unit, they were looked after. If not, then people, as other comrades have said, died, had nowhere to go. And that is just what we are at already, and it's just going to get worse.
Thanks very much, Soraya. I don't know if anybody wants to come in or come back for a very short point. I know I cut some people off quite quickly, the Minnie and Peter, perhaps, if you want something else to say. No? Okay. Well, Minnie, I thought you would.
Yeah, it was just the point. I understand it's the system, capitalism, that, is the fuck up that is that's causing all this. But, there are some not very nice people, because there are people at the top of companies that are aware that their policies, that their drive for profit is killing people. People are being killed over and over again in our thousands, by these private companies. It's just sick.
Thanks, Minnie. That's a good link for the point I want to make before I invite Ian back, because nobody's mentioned the role of the pharmaceutical companies and the money that they make out of the NHS system and the money that they make in America. And I'm pretty certain that most of you will have heard or watched the remarkable TV series about the OxyContin scandal in America, where the Sackler family essentially produced this addictive painkiller and made billions out of it and got their name on art galleries all around the world as a result. But they basically destroyed millions of people's lives and through their drive for profit. I'll just recommend the two series that I would suggest that you watch if you haven't seen them is Painkiller and Dope Sick, both very good dramatic interpretations of that scandal. With that, I'm going to invite Ian. If you could come back for 10 minutes, Ian. I know there's been a lot raised, so you've got a bit of a difficult job, but yeah, 10 minutes.
Yeah, fortunately, I don't really disagree with anything anybody said. What I wanted to say really was, firstly, just as capitalism throws up the kind of art and literature of its age, just as it throws up the kind of education system that it does, it throws up the medical system that it does. Medicine and health are distorted completely by capitalism. Put bluntly, hospitals are nasty, dirty places full of sick people. and a world which was reconstructed in such a way as to meet all human need would be totally different. The reflection, the form taken by healthcare is a reflection of the wider division of labour. So, for example, old people become a burden because people have to work. We could reorder society in such a way as that the elderly are somehow not a problem. If you have a situation where people have to spend 8 hours of every day working, then the idea that you've got time to look after elderly relatives with neurodegenerative disorders is just fanciful. Hospitals themselves take a form almost like a Victorian factory. I'm old enough to remember Nightingale wards, where literally you would have a row of beds either side of the ward, effectively as a representation of the conveyor belt, and you put the trolley to wash the patients at one end, and you move from the sickest up to the less sick. In a conveyor belt type system. So the form taken by health is a capitalistic form, including all the kind of hierarchy associated with the professions, which have rigorously done everything they can to defend themselves. We have to remember Aaron Bevan's famous quote that the reason why consultants eventually came on board with the NHS was because their mouths were stuffed with gold. Generally speaking, the professions have not necessarily been on the side of the working class. For all that, what we're seeing is a kind of deprofessionalization, really just to force down wages. So what I would put forward, I would suggest, is the time-honored communist solution of a minimal program in which we demand that all healthcare is to meet human need and is free at the point of delivery. But our maximum demand ultimately will be to move to a society where, for example, private property becomes public property, the common ownership of the means of production, and on the basis of that, we dismantle the system of wage labour. Ending the system of wage labour ultimately means that instead of spending 8 hours of your day doing some job that you don't particularly like, you're free to develop yourself in any number of other ways. And that would include childcare, care of the elderly, care of the sick. The truth is that what most hospitals are is great concentrations of incubi alongside sick people. So I think we would move, towards a much more community-based, locally based system. Coming back to this question about the causes of sickness, Jeff rightly pointed out the groundbreaking work of Kate Pickett and Richard Wilkinson, pointing out that it's not just simply poverty that makes people sick, but also the level of inequality exerts an influence independently of poverty itself. So you can have a situation where a country with a greater gap between rich and poor has worse health than a country which has a narrower gap. And you can see that, for example, in the comparison between the United States and Japan, notwithstanding the fact that they both have a social insurance type of system. The gap between rich and poor is narrower in Japan and the health is better. You also have a situation in Japan where, of course, the idea of looking after one's elderly relatives is integrated into the nature of the society. And I think that any kind of communist society would do the same. Let's not forget cortisol, a key stress hormone, which if you're being chased by a lion on the Serengeti will save your life. If you're, however, producing cortisol day in, day out because your boss is an asshole, what you get is a situation where parts of your immune system are switched off. So you develop cancers, so you develop infections. Your reproductive system is hindered. A whole range of things take place. You produce more blood sugar. Type 2 diabetes has a direct relationship between the stress that's associated with low social status and poverty. you could dramatically halve the numbers of people with type 2 diabetes overnight by abolishing wage labour. We leave aside any kind of discussion around it. It's a complex issue, but around, for example, the relationship of human alienation and psychiatric disorders. Think of the sheer millions of people who are currently taking some form of psychoactive substance, typically selective serotonin reuptake inhibitors for the treatment of depression or anxiety and so on. Not least of which because it's incredibly lucrative for big pharma. Try getting specialist psychiatric services. I mean, if you're lucky, you'll get some cognitive behavioral therapy. Why? Because it's cheap. Try getting any more psychotherapy over and above your 6 CBT sessions, and you'll be very lucky indeed. County Durham dismantled entirely its specialist personality disorder services some years ago. And instead we see not decarceration, but we've actually seen recarceration. So as the asylums closed, the prisons filled up and expanded enormously. I mean, I've worked as a nurse in prisons as well. And Durham Prison, for example, has a whole wing purely dedicated to people with mental ill health, has another whole wing dedicated to people receiving substitutes for opiate addiction. A sizable proportion of Durham Prison should properly be in a psychiatric hospital, and that's leaving aside the fact that on every single wing in Durham Prison, patients, inmates queue up every morning for some sort of for medication to make the misery of life a little bit bearable. Quite apart from what happens within the NHS, of course. I think the crucial thing is that communism is not the welfare state. And although I would defend free medicine as part of our minimum programme, I would want to see a complete transition away from commodity production. And that means commodity production, whether it's in terms of pharmaceuticals or whether in terms of care, whether it's community care or hospital care. The ideal solution, I think, is for health to become a kind of how many people today are sick simply by virtue of the fact that they have nothing else to sell but their labour power. I think what we would see is a complete transformation of human health. I don't think, as I say, there's anybody I would take issue with at all. I just think that you already know the answer, and the answer can't, whatever else happens, lie with capitalism, because what we'll now face is the dismantling of the NHS to pay for guns. There's no shortage of money for war, and our transition to a war economy is going apace. We can expect war and nothing but war for the foreseeable future, and the working class will pay for it. They'll pay for it with their lives, and they'll pay for it in their pay packets.
Thank you very much, Ian. Well, comrades, I think that was a brilliant discussion, really excellent introduction and reply by Ian. And I'll just refer to Chris Marsh's comment, which I agree with. So much wisdom and common sense here, very refreshing. I learned so much in the course of the last hour discussion, really tremendous. But what I would like to ask is that everybody who's spoken, obviously Ian starting off, but then everybody else has essentially given at least one, if not two or three or more articles for the TAS website. I don't know if you're aware of this, but when the video goes up on YouTube, you can watch the transcript. You can read the transcript, and it means that you could download what you said in your contribution. And I'm sure with very little editing, you could turn your contribution into a brilliant article, which I think deserves a bigger audience. So please consider whether the points that you've made in your contribution orally or in the sidebar everybody covering a whole array of issues. Please think about writing the article, sending it in to us, and we'll put it up on the website. That would be great. So we're now just moving to the last 15 minutes to give people an opportunity to ask any questions about the process of discussions between a number of organizations. Some of you will know, and it might be new to others, but talking about socialism has got in its, if you like, its fundamental statement of aims and principles. It says that we're committed to working with others to create the core or the nucleus of a new democratic mass communist party. And so we've always been keen to try to find others who share that goal. And there are many people in the Labour movement, but at the moment we've actually developed a discussion. We've had 4 meetings so far of a process that we've called Forging Communist Unity. And the organisations involved are the Communist Party of Great Britain, which produced the Weekly Worker. And as I said, Ian is a member of that organisation. We've got Talking About Socialism from a Marxist Point of View, which has been going for about 2 years. And our Zoom discussions are all up on YouTube, on the website, on the YouTube site. And we've got our own articles. And then we've got a third participating group, which started out being the editorial board of Prometheus, the online journal. And at the first meeting, we also had a representative of RS21. So just to bring you up to date and do a sort of quick tour through what's happened. RS21 decided that they wouldn't participate any further after the first meeting because they haven't really discussed it. So that left us with the 3 organizations that I've mentioned. Prometheus have been discussing it on their editorial board, and it was reported at the last meeting that we had, which was yesterday morning. That was the 4th of the meetings. It was reported that the Prometheus editorial board essentially is split down the middle. Half of them are very keen to continue participating in the discussions, and half of them are a bit more cautious or skeptical. We wrote to the Prometheus editorial board suggesting that we meet with them to discuss any concerns, and we understand that the half that are skeptical or not so keen are going to reply, and we're going to meet with them hopefully at some stage soon, most likely in London. But yesterday, those of us that were involved, that's the CPGB, TAS, and the, if you like, the pro-fusion process of the editorial board of Prometheus, we began to discuss the first of a series of questions that had been proposed by Talking About Socialism, and which had been agreed as a way to develop the move towards a possible fusion. And that was, what sort of program and principles should a fused organization have? And we began discussions on that, and we're going to come back to it in a fortnight's time. And so far, there's been very obvious agreement. Our aim is for communism. Our aim is internationalism. Our aim is to build a mass communist party in order to help achieve those things. The Communist Party of Great Britain have their own draft programme, which is quite substantial. We have a briefer, shorter aims and principles document, which you can find on our website. And those are both going to be thrown into the mix, probably concentrating to begin with on the draft programme of the CPGB. I think the view of Ed Potts and myself, who've been attending these meetings, is that we'd prefer a shorter, more succinct programme, but it's up for discussion. I will say that those of us that have participated in the first 4 meetings are getting on well. We are all committed and determined to try to make this process a success. Adjunct to this process, there have been a series of other meetings, one of which took place on Thursday. I know that Peter was there. I don't know if anybody else was there. There was a webinar organised by Y Marks, at which Jack Conrad spoke for the CPGB. Katrina Ryland spoke for the Prometheus editorial board in a personal capacity. I spoke for Talking About Socialism, and we all addressed the subject, why we're fighting for a mass communist party and how. I thought that was a useful way of bringing people together, and my own take on it was that we seemed to pretty much agree on everything that was raised in the course of that debate and discussion. Obviously, not everything could be touched on. We then also had a meeting on Saturday, which was a joint day school organised by Prometheus and Talking About Socialism, an in-person meeting in Manchester. And I'm just going to ask Soraya, who attended, to give a brief report and her views on that.
It was. I thought it was really positive. It was. I hope I've remembered properly. I think 41 people registered for the meeting, and at one point there were 41 people there. It was a young meeting. I would say the average age was probably late 20s to early 30s, which was very encouraging. Started off with 2 speakers, one from the CPGB and one from Prometheus editorial board, so everybody was in that discussion, and then people went into they call them workshops. Anyway, so groups, smaller groups, to discuss various questions about what are the obstacles to unity, what are the biggest obstacles, and then how do we get from here to there. And the discussions that I was involved in, smaller groups, were very positive and interesting. There were people there from the comments from Talking About Socialism, from the Prometheus editorial board, people from RS21, and some from the CPGB, and local comrades. I didn't know if, by any stretch of the imagination, I didn't know most of the people who were there, which I always think is a good thing, because you're meeting fresh new people, and it's always good to do that. And there were some local comrades that I did know, not connected. There are quite a few people not connected to anything, but wanting to discuss and interested in the idea of unity on the left. So I thought it was very, very positive, and I'm very glad that I went.
Thanks, Soraya. In fact, in the group that I was in, I think there were 10 of us in the group, and the majority of people there, I think 6, weren't in any group. They were interested in the idea of what these Marxist groups were doing, saying, and one person in the report back said it was encouraging to hear Marxist groups talking about merging rather than splitting. The last point I want to make before I see if there's any questions, our videos, as I said earlier, go up on YouTube, and we normally get a couple of hundred views. The one that we did last time, which was on this theme, not a Corbynite party, but a communist party, which is in the context of people getting to know about these fusion talks, has had 1,100 views. So there's some interest there. I'll just finish by saying nobody's getting carried away or wants to exaggerate what's happening. It's discussions between small groups, small forces, but we think it's got the potential to have a bit of an impact. With that, can I just ask if anybody's got any questions about the process.
I've got a quick question, but before I do that, we really do, it's heartening to hear that this process is going well. And albeit it will be a small beginning, we really do need a mass communist party. And, you know, I'm with the Socialist Theory Group in Liverpool, and we put a meeting on. It was Paul put a meeting on, and it was just advertised for local central library, and we got 23 people. And from that, we got 3 people coming to our meetings, 2 of which were school lads from school, and their girlfriends, and then there was another woman who's still with us. But it was just a room full of people, like you say, so we'd never met before, most of them, and it was people of all ages. It was inspiring, but there's nothing there to keep people together. We need a structure. And one question I have, a quick question, is I know that it's the how. It's great to hear that people are having good talks and it's all going well. And I know that people will be gathering around the acceptance of a program, not the total agreement, but the acceptance of a program, and the development of that. But what is the process for these groups to then move on democratically to approve whatever's going on? How does that vote? Because I know, for example, why Marks aren't totally involved because, and they do the education because they're not a membership structure, but as far as I'm aware, we're not a membership structure. And Graham and I, we attend CPGB meetings, talking about socialism, why Marx, all sorts. That's it for now, anyway.
Thanks, Minnie. Good question. Ian.
Again, not really a question. It's just to report that, that there will be, of course, coverage in this week's Weekly Worker, so which will hit the airwaves, the ether on Thursday night, and there will be at least one report in there. As you know, there were a number of leading figures within the CPGB there, and you can expect, and you know, the whole process has been warmly welcomed, and I eagerly await the founding Congress, comrades.
Yeah. Anybody else got any questions? Okay, well, just on Minnie's point, the question of democratic structure, rules, etc., how we take decisions, how we implement them, and so on. That's one of the discussions that we've got to have in this process. We're meeting every fortnight, and we've got a series of questions to work through. You'll find those on the TAS website in the article on Forging Communist Unity. What we would like is to have your input. And I think we probably should organise a TAS meeting for people who are keen to participate in this process, so that we can discuss how we can involve everybody. As I say, the organisers, we're very keen, very encouraged, and we think it would be a big step, a small step, but a big step, if you see what I mean, if we can pull this off. But the question of democracy, the question of structure, the issues that put off quite a large number of people who have been through one of the so-called revolutionary socialist organizations, perhaps, or people that look at and don't feel inclined to join because they don't agree with the way that things are organized. That's central to what we're trying to do. And Minnie was right. What we're looking at is developing a program which people would accept if they joined, but wouldn't necessarily agree with every dot and comma or even part of it. But we're looking to be in a fused, unified organization with the opportunity to continually debate and discuss, and if necessary, change the constitution that we originally arrive at. And with that, just one second, Janet. Okay, so Janet would have asked the same question. So what I'm going to do is we'll send out a bulletin, and we'll ask those of you who are particularly interested to let us know, and we'll work out how to take it further. With that, can I thank everybody for attending, and just let you know that next fortnight we'll be discussing, we've got Tina Workman and an organizer of Why Marks, along with Ian. She's going to be reporting on the German federal elections, which take place on the day before. Very, very interesting. I'm sure you've seen the terrible developments with the AfD and the CSU accepting its votes on anti-immigration policies and so on. Fortnight after that, we've then got Moshe Machova. And a fortnight after that, we've got Owen Miller, who's a lecturer at SOAS, a specialist in Korea, who's going to be introducing a discussion on what's been taking place in Korea over the last month or so. So with that, thank you very much for attending. We'll see you all in a fortnight's time. Good night.